Imagine you are trying to remodel a room. You're putting up this delicate new wallpaper, you're reinforcing the drywall, and the plaster is literally still wet.
Right. Highly sensitive.
Exactly. And right in the middle of that highly sensitive construction zone, someone comes along and sticks an industrial strength suction cup directly onto the wall and just pulls.
Oh, man. Yeah. I mean, you're applying immense mechanical tension to an environment that is at its absolute most vulnerable. It is just a recipe for structural disaster.
It really is. And today on the deep dive, we are looking at that exact scenario. But the room is the human body.
A very specific part of the body, yes.
Right. Welcome to the deep dive, everyone. Our mission today is to explore a fascinating intersection of two massive trends in women's health. We're looking at the booming popularity of menstrual cups and the rapid rise of non-surgical vaginal tightening procedures.
Two things that are, completely changing the landscape right now.
Absolutely. And we are answering one ultimate question for you today. Can you safely use a menstrual cup after having one of these medical tightening procedures?
And to find that answer, we really have to look at the strict medical science, the clinical protocols, and the regulatory oversight all at once, because it gets complicated.
It does. Okay, let's unpack this. We are pulling from a pretty diverse stack of sources to figure this out.
We have some heavy hitters today.
Yeah, we have biomechanical studies analyzing the actual physical forces exerted by menstrual cups. We're looking at clinical guidelines from aesthetic centers, specifically places like Valley Aesthetics Institute and Adelo Aesthetics.
Right, getting the on-the-ground clinic perspective.
Exactly. And we're also bringing in official medical reviews regarding laser and radiofrequency vaginal therapies, alongside some very specific FDA safety communications.
Because, before we just slap that suction cup on the wet plaster, we need to thoroughly understand how the cup and the tightening procedures function independently.
Yeah, let's start with the cup. For anyone who uses one, it's a small, flexible, bell-shaped device, usually made of medical-grade silicone or rubber. And it holds about 1 to 2 ounces of fluid, which, for context, that is up to 5 times more than a standard tampon.
That capacity is huge. That's what allows for up to 12 hours of continuous wear, which, fundamentally changes how a menstrual cycle is managed.
Yeah, completely. But the mechanism of action is the crucial distinction here. A tampon operates through absorption, right? It functions as a sponge.
Yes.
But a menstrual cup operates through collection. It functions as a bucket.
A bucket that you really, really do not want to spill.
Exactly. And to make sure that bucket doesn't spill, it relies on a specific physical mechanism. It's exactly like that suction cup on the freshly plastered shower wall we talked about. It relies entirely on a vacuum seal to stay securely in place and prevent leaks.
And the physics behind that seal are incredibly powerful. When a user folds the cup and inserts it, the material springs open.
Right, it pops open.
And it pops.
Yeah.
And as it unfolds, the rim creates this continuous 360-degree airtight seal against the vaginal walls. This action basically generates negative atmospheric pressure inside the vaginal canal.
Meaning the cup is actively pulling inward on the surrounding tissue.
What's fascinating here is just how strong this negative pressure is when we look at the biomechanical data.
How strong are we talking?
Well, our sources review the suction dynamics of these cups, particularly looking at instances involving intrauterine devices, IUDs.
Oh, right. Because an IUD sits up inside the uterus, but its removal strings hang down through the cervix and into the vaginal canal.
Exactly. So they share the same physical space.
Wait, so the suction from the cup can affect those strings?
Yeah, the upward biomechanical force generated by the cup's vacuum is significant enough to affect the device itself. The sources show that if the suction isn't broken properly before removal,
meaning the user doesn't physically reach in and pinch the base of the cup?
right, if you don't pinch it to allow air to enter and release the vacuum, the mechanical force of pulling that sealed cup down can literally dislodge an IUD from the uterus.
Wow. It is pulling hard enough to move an implanted medical device out of an entirely different organ.
It really is. The constant tension and suction aggressively engage the vaginal walls. So the takeaway for you listening is that a menstrual cup isn't just some passive container resting inside the body.
Right, it's doing work.
It is an active, dynamic, mechanical force that is constantly engaging the surrounding tissue.
Okay, so if the cup relies entirely on the specific shape, tension, and structural integrity of your vaginal walls to maintain that airtight seal, what happens when you decide to medically alter those walls?
And that is where we turn to the non-surgical tightening treatments.
These are the energy-based medical devices that the industry markets for quote-unquote vaginal rejuvenation. Looking at the sources, we are talking about devices that use fractional CO2 lasers. You might see them marketed under brand names like Mona Lisa Touch or V-Lays, or radio frequency tools like ThermEV.
Right, those are the big ones. And clinics use them to treat laxity, which is a feeling of looseness often associated with childbirth or aging.
And they're also used to treat dryness and mild urinary incontinence, right?
Yes, exactly. And the underlying mechanism for all of these devices is the application of controlled thermal energy to the vaginal mucosa.
But reading how they actually work made me pause, because these devices use intense heat to rejuvenate the tissue. Wait, so we are intentionally burning or injuring the tissue to force it to become healthier?
That is the core concept, yes.
It sounds like aerating a lawn. Like when you have a struggling lawn, you hire a machine to aggressively poke thousands of holes in the dirt, purposefully injuring the root system, simply so the grass is forced to grow back thicker and greener. Is that what these lasers are doing?
That is a perfect analogy, honestly. The medical term for aerating the lawn in this context is creating microthermal injuries.
Okay, microthermal injury.
Right. A fractional CO2 laser vaporizes tiny spaced-out columns of tissue, while radio frequency waves deliver deep, bulk heating without breaking the surface. But both methods are designed specifically to trigger the body's natural wound healing cascade.
So the body detects the thermal burns and just goes into overdrive repair mode.
Exactly. The thermal stress wakes up cells called fibroblasts, which are located in the lamina propria.
That's the layer of connective tissue just beneath the surface lining, right?
You got it.
Yeah.
And when these fibroblasts are stimulated by the heat injury, they cause a massive surge in a process called neocollagenesis.
The production of new collagen.
Specifically, the body starts producing dense, rigid, type I collagen fibers,
Okay.
alongside highly elastic type 3 fibers.
Yeah.
And the heat also triggers neoangiogenesis, which is the formation of new blood vessels in the area.
So it's building a whole new support structure.
Right. The end result of this wound healing cascade is tissue that has structurally rebuilt itself to be thicker, more elastic, and better lubricated.
But before we figure out how the vacuum seal of a menstrual cup interacts with this newly rebuilt tissue, we have to address the safety profile of these procedures, because our sources highlight a massive divide between what aesthetic clinics are claiming and what regulatory bodies are warning.
It's a very stark contrast. Looking impartially at the landscape, many aesthetic clinics and certain clinical studies point to really high patient satisfaction rates.
Right. Patients frequently report significant relief from painful dryness, a noticeable improvement in elasticity, and just a better overall quality of life following the treatments.
But on the flip side, the FDA has issued very strong safety communications regarding these exact same energy-based devices.
Yeah, they warn that devices marketed for vaginal rejuvenation currently lack robust, long-term safety data.
And they aren't just saying it might not work. The FDA cites potential serious risks, including severe vaginal burns, irreversible scarring, and chronic pain.
Some of the medical reviews we analyzed, like those from NICE, that's the National Institute for Health and Care Excellence in the UK, they align with this regulatory caution.
Yeah, they state that the evidence on long-term safety is simply inadequate. They suggest these laser therapies should be approached with extreme caution.
Often recommending they stay confined to clinical research settings until more comprehensive long-term data is actually gathered.
So it is the classic tension between rapid clinical demand and the rigorous long-term randomized trials required for universal medical consensus.
The law narration process is not universally accepted as risk-free, basically.
Exactly. Keeping that clinical tension in mind, we can look at what happens when these two elements finally collide.
Okay, yes. We have a device, the menstrual cup, that applies constant suction and mechanical tension to the vaginal walls.
Right.
And we have a procedure, the laser or RF treatment, that just created thousands of microthermal injuries on those exact same walls. Here's where it gets really interesting. Can you use a menstrual cup immediately after the procedure?
The clinical sources all agree on this one. Absolutely not.
Not a chance.
No. Patients are instructed to institute a period of strict vaginal rest.
Vaginal rest. And the timelines for this vary slightly depending on the specific clinic and how aggressive the thermal treatment was, right?
Yeah, but the consensus is a strict ban for several days. Clinics like Adelo Aesthetics and PRFCT give explicit instructions to avoid inserting anything into the vagina for at least 3 days.
And they specifically call out vaginal cups and tampons in their post-care protocols?
They do. And other clinics go even further. Valley Aesthetics Institute and Allen Aesthetic Surgery have much more conservative protocols.
What do they say?
They mandate that patients abstain from menstrual cup use, along with any other internal items or strenuous physical activity, for a full 7 days.
Wow, a whole week of complete
A
rest.
full week. This raises an important question, though.
Yeah.
Why such a strict ban?
Yeah, why?
The answer lies in the biology of the healing process. Immediately after the laser treatment, the tissue is highly vulnerable. It is inflamed, it is often swollen, and it is actively trying to lay down that delicate new collagen matrix we discussed.
So the new grass seed is just taking root.
Exactly. Now, introduce the outward physical pressure of a menstrual cup trying to expand, combined with the intense negative atmospheric pressure of its suction.
It would pull directly on the healing mucosa.
It would physically disrupt the newly forming collagen network. It could severely delay or entirely ruin the healing process.
Yikes.
Yeah, and the clinical protocols note that it is completely normal for patients to experience spotting or a watery, sometimes gray discharge for a few days post-procedure as that vaporized tissue heals.
Oh, wow. Applying a vacuum seal to tissue that is actively weeping and recovering seems like it would drastically increase the risk of infection.
Absolutely.
Yeah.
At the very least, it would exacerbate the bleeding and cause significant internal discomfort. The mechanical trauma of inserting, expanding, and particularly removing a vacuum-sealed cup is precisely what the micro-injured tissue cannot handle.
It just needs peace.
The tissue requires absolute peace to successfully rebuild.
Okay, so you respect the 3 to 7 day window, you use a pad and let the tissue repair itself. But what happens once that healing window is completely closed?
Right, once you're healed.
Say it's been a month, the neocollagenesis has occurred, and the tissue is fully healed. Can you go back to using your cup?
After the acute healing process is complete, yes, menstrual cups are safe to use again, but you have to account for the fact that the physical environment has literally changed.
The internal topography is different now.
Exactly. If the laser or RF treatment was successful, the vaginal walls are now thicker, firmer, and the canal is generally tighter.
And there is also an increase in natural lubrication.
Right. So because of this altered landscape, a menstrual cup that fit perfectly before the procedure might not fit the same way afterward.
There is a detail in the clinical studies on cup firmness that really stood out to me. Menstrual cups are manufactured in different sizes, obviously, but also different levels of firmness based on how rigid the silicone is.
Which plays a huge role here.
Yeah. A softer cup is easier to fold for insertion, but a firmer cup pops open more aggressively and tends to create a stronger, more resilient seal against the walls.
So think about that. If the vaginal canal is suddenly tighter and firmer from the laser procedure, and you insert a firm cup, the surrounding tissue won't yield as much as it used to.
The outward pressure from the cup has to go somewhere, so it ends up pressing outward against the surrounding anatomy, specifically the bladder and the urethra.
And the urethra runs directly anterior to the vaginal canal. They sit very close together.
The sources mention a very specific complication that can arise from this outward pressure. If a firm cup presses too hard against the urethra, it can restrict the flow of urine. It causes urine to literally back up into the kidneys.
Yeah, the medical term for this, which was noted in the health shots source, is ureterohydronephrosis.
Ureterohydronephrosis, which basically means the kidneys become swollen, right?
Exactly. The urine cannot drain properly into the bladder and out of the body because the urethra is being physically compressed by the firm menstrual cup residing within the newly tightened vaginal canal.
It's like putting a kink in a garden hose. The pressure builds up backward.
It is exactly like that.
There are case studies where women experienced lower back pain, which they didn't realize was actually undiagnosed kidney pain, that entirely resolved the moment they removed their overly firm menstrual cup.
If we connect this to the bigger picture, it means that after undergoing a tightening procedure, you have to relearn the mechanical limits of your own body.
Yeah, you might need to size down your cup or switch to a softer, more flexible material so that it doesn't compress the urethra in this new, firmer space.
It requires active troubleshooting. It is not a set it and forget it situation anymore.
Mhm.
And it also heightens the importance of the golden rule of menstrual cups, which is meticulously breaking the seal.
Because the tissue is now firmer, the structural grip the vaginal walls have on the cup can be significantly tighter.
Yes, you must reach in and physically pinch the base of the cup to let air in before attempting removal.
Because if you try to pull the cup out of a newly tightened, highly vascularized canal without breaking that vacuum,
You risk damaging the newly regenerated tissue, causing micro tears, and inducing severe internal discomfort.
ouch!
Yeah. The suction is a very real mechanical force, and while the new tissue is stronger, it still requires careful handling during the cup's removal.
Okay, so looking at the entire deep dive today, the answer to our core mission question is yes. You can safely use a menstrual cup after having a non-surgical vaginal tightening procedure like a CO2 laser or radiofrequency treatment.
But you must adhere to the 3 to 7 day vaginal rest period to allow the microthermal injuries to heal without the severe disruption of intense suction and mechanical tension.
And once you are fully healed, you have to acknowledge the physical changes in your internal topography.
Hmm.
You may need to reevaluate the fit, the size, and the firmness of your cup to ensure it isn't pressing against your urethra and causing secondary issues like ureterohydronephrosis.
It's all about understanding the mechanical realities of the body.
Which makes me wonder where this intersection of intimate health and technology is heading next.
Well, there's a detail in the biomechanical sources that points to a pretty fascinating future. It briefly mentions the development of IoT-based smart menstrual cups.
Wait, a smart cup?
Yeah, these are cups equipped with tiny microsensors designed to actively monitor the fluid they collect.
With sensors sitting inside the body for 12 hours a day? That is wild.
Think about the implications based on everything we covered. We've established that the walls of the vagina dynamically change due to aging, childbirth, and aesthetic therapies. If we have sensors in constant contact with those walls, the smart cups of the future could potentially do a lot more than just collect fluid.
Oh, I see. They could monitor the elasticity and collagen density of the internal tissue itself.
Exactly. They could turn a basic hygiene product into a real-time diagnostic tool for your pelvic health, monitor the tension, the structural grip, and the microenvironment of the vaginal canal as it changes over time.
That is incredible.
It's definitely something to ponder as technology becomes more deeply embedded in our everyday biology.
Seriously, we go from worrying about a suction cup ruining a remodeling job to that suction cup potentially acting as the structural building inspector.
Right.
Well, thank you for joining us on this deep dive. Keep questioning the incredible science behind everyday health, and remember to always read the post-care instructions before you stick a suction cup on a freshly plastered wall. We'll catch you on the next deep dive.